Welcome to Nursing Prep. Push yourself in nursing preparation with Smart Way. Practice this quiz on www.thestudyblog.com. Fundamentals of nursing. When a patient in the terminal stages of lung cancer begins to exhibit loss of consciousness, a major nursing priority is to: Option A. Protect the patient from injury. Option B. Insert an airway. Option C. Elevate the head of the bed. Option D. Withdraw all pain medications. Right answer is Option A. Protect the patient from injury. Ensuring the patient's safety is the most essential action at this time. Options: the other nursing actions may be necessary but are not a major priority. Which element in the circular chain of infection can be eliminated by preserving skin integrity? Option A. Host. Option B. Reservoir. Option C. Mode of transmission. Option D. Portal of entry. Right answer is Option D. Portal of entry. In the circular chain of infection, pathogens must be able to leave their reservoir and be transmitted to a susceptible host through a portal of entry, such as broken skin. Which of the following will probably result in a break-in sterile technique for respiratory isolation? Option A. Opening the patient's window to the outside environment. Option B. Turning on the patient's room ventilator. Option C. Opening the door of the patient's room leading into the hospital corridor. Option D. Failing to wear gloves when administering a bed bath. Right answer is Option C. Opening the door of the patient's room leading into the hospital corridor. Respiratory isolation, like strict isolation, requires that the door to the patient's room remain closed. However, the patient's room should be well ventilated, so opening the window or turning on the ventricular is desirable. The nurse does not need to wear gloves for respiratory isolation, but good hand washing is important for all types of isolation. Which of the following patients is at greater risk for contracting an infection? Option A. A patient with leukopenia. Option B. A patient receiving broad-spectrum antibiotics. Option C. A post-operative patient who has undergone orthopedic surgery. Option D. A newly diagnosed diabetic patient. Right answer is Option A. A patient with leukopenia. Leukopenia is a decreased number of leukocytes, white blood cells, which are important in resisting infection. None of the other situations would put the patient at risk for contracting an infection. Taking broad-spectrum antibiotics might actually reduce the infection risk. Effective hand washing requires the use of Option A. Soap or detergent to promote emulsification. Option B. Hot water to destroy bacteria. Option C. A disinfectant to increase surface tension. Option D. All of the above. Right answer is Option A. Soap or detergent to promote emulsification. Soaps and detergents are used to help remove bacteria because of their ability to lower the surface tension of water and act as emulsifying agents. Hot water may lead to skin irritation or burns. After routine patient contact, hand washing should last at least Option A. 30 seconds. Option B. 1 minute. Option C. 2 minutes. Option D. 3 minutes. Right answer is Option A. 30 seconds. Depending on the degree of exposure to pathogens, hand washing may last from 10 seconds to 4 minutes. After routine patient contact, hand washing for 30 seconds effectively minimizes the risk of pathogen transmission. Which of the following procedures always requires surgical asepsis? Option A. Vaginal instillation of conjugated estrogen. Option B. Urinary catheterization. Option C. Nasogastric tube insertion. Option D. Colostomy irrigation. Right answer is option B. Urinary catheterization. The urinary system is normally free of microorganisms except at the urinary meatus. Any procedure that involves entering this system must use surgically aseptic measures to maintain a bacteria-free state. Sterile technique is used whenever option A. Strict isolation is required. Option B. Terminal disinfection is performed. Option C. Invasive procedures are performed. Option D. Protective isolation is necessary. Right answer is option C. Invasive procedures are performed. All invasive procedures, including surgery, catheter insertion, and administration of parenteral therapy, require sterile technique to maintain a sterile environment. All equipment must be sterile, and the nurse and the physician must wear sterile gloves and maintain surgical asepsis. In the operating room, the nurse and physician are required to wear sterile gowns, gloves, masks, hair covers, and shoe covers for all invasive procedures. Strict isolation requires the use of clean gloves, masks, gowns and equipment to prevent the transmission of highly communicable diseases by contact or by airborne routes. Terminal disinfection is the disinfection of all contaminants. Which of the following constitutes a break in sterile technique while preparing a sterile field for a dressing change? Option A. Using sterile forceps, rather than sterile gloves, to handle a sterile item. Option B. Touching the outside wrapper of sterilized material without sterile gloves. Option C. Placing a sterile object on the edge of the sterile field. Option D. Pouring out a small amount of solution, 15 to 30 milliliters, before pouring the solution into a sterile container. Right answer is option C. Placing a sterile object on the edge of the sterile field. The edges of a sterile field are considered contaminated. When sterile items are allowed to come in contact with the edges of the field, the sterile items also become contaminated. A natural body defense that plays an active role in preventing infection is option A. Yawning. Option B. Body hair. Option C. Hiccuping. Option D. Rapid eye movements. Right answer is option B. Body hair. Hair on or within body areas, such as the nose, traps and holds particles that contain microorganisms. Yawning and hiccuping do not prevent microorganisms from entering or leaving the body. Rapid eye movement marks the stage of sleep during which dreaming occurs. Thanks for watching. You can also practice this quiz on www.thestudyblog.com, link in description box. If you have any doubt, ask in comment section, and you like our video, then do like, comment, share. Subscribe our channel for regular updates.